As we look to the future, UNMC will determine and develop the best methods to teach and assess clinical competencies. The ability to test empathy, understanding of patients' culture, and critical thinking skills will ensure patients have highly trained healthcare professionals. Techniques like virtual technology and simulation give us the most up-to-date tools to train a generation of technically savvy students. Our graduate education program are an important pipeline for future basic science researchers and faculty. As our research enterprise grows, our future depends in part on our ability to attract, support, and prepare top students for the workforce. The IRB, Student Services, and McGugan Library staffs are the backbone of our unit, and together, we will deliver world-class healthcare education to our students, our faculty, and our community.
The University of Nebraska Medical Center is poised to move into all of the important areas of research in the 21st century, and they would include specialized medicine based on the Human Genome Project, new antibiotics, regenerative medicine. Those are the areas that are going to save lives, they're going to prevent disease. They're highly technical, highly specialized, they're consistent with the things that we do here, that we do well. We're getting calls from scientists from around the world saying, do you have a place for me at UNMC? I'm actually as optimistic as I've ever been about anything about UNMC research in the 21st century.
Our purpose and our priority as a healthcare provider in this community is to provide the tertiary quaternary type services that no one else can do. And you know, the good news is we've been able to expand a number of those in the last 4 or 5 years and develop programs, you know, such as neurosurgical oncology, which we really weren't doing in that detail before. You'll see the expansion of a number of the areas in the neurosciences. I think we just, for example, implemented the MEG scanner, and that'll strengthen us even more as the leader in these types of programs in areas such as epilepsy and neurosurgery and psychiatric research and so forth. So I'm very excited. I think that that is our responsibility to provide those types of resources that are not available, not just in the state of Nebraska, but in the areas around us from anybody else.
Our vision for the practice is to support the College of Medicine, to support our hospital partners, which include the Nebraska Medical Center, the Bellevue Medical Center, and Children's Hospital. Going forward, we're looking at a potential hospital in West Omaha. We've opened a cancer center in cooperation with the Nebraska Medical Center, and we've opened a medical spa or a plastic surgery center, an ambulatory surgery center out at Village Point, adjacent to the cancer center, and then we're shortly going to open a new medical office building at Village Point. So we'll have basically a campus at 180th and Dodge. The areas of specialty and focus that we have tried to concentrate on are cancer and transplantation, cardiac care, neurosciences, and those really fit with both the mission of the hospital and the mission of the college.
It's become very evident nationally that to be a ranking academic health science center in the future demands a strong international program.
We have collaboration with multiple institutions in Asian Pacific regions, which is an important area for economy and for the future.
We have many faculty relationships already there. We have faculty from the Asian Pacific Rim countries here on campus, and they happen to also be a majority of the graduate students that we have on campus and have had for this last decade.
I personally work in Afghanistan as it has become very important, a national priority, and so we're trying to increase our involvement, particularly in the educational sector in Afghanistan, and become one of the leaders in the United States. And our major emphasis has been faculty development and education within the Kabul Medical University in Kabul. We have exchange programs, And we currently are applying for money to teach medical English to their faculty, as well as doing some things in the public health arena with biopreparedness.
This year we are finalizing a new institute for general medicine. There is not a program of family practice in China. And last year we took a delegation from our Department of Family Practice. Eventually we hope to have the College of Nursing, the Public Health, Dentistry, and we're taking Kyle Meyer from Allied Health to review programs there. They have selected us because of our prominence in rural medicine and primary care. I think this is all very exciting.